increased cases of the flu are normal for this time of year, and now doctors are treating more patients with RSV and COVID-19 as well.
CBS 8's Ariana Cohen spoke with a local doctor who says lessons learned during the pandemic have them prepared now for the worst.
Flu season usually ramps up in the fall and winter. Yet now, San Diego County is also dealing with cases of RSV and COVID-19 as well. I spoke with Dr. Keith Yablonicky, who works in the emergency room at Sharp Memorial Hospital.
Certainly, influenza and RSV are high. I mean, this is the season for it. Typically in the winter, you see a lot of RSV. It's, 125,000 annually throughout the United States.
Currently, he sees 6 to 10 patients with RSV per day and 10 patients with flu per day in urgent care, which he says is an influx but normal for this time of year.
So it is kind of par for the course with influenza. And just as a medical professional, it's kind of nice to see kind of more normalcy, to see some influenza come back into our communities. It's not great. People die from influenza, but it's certainly something we're experienced in.
Dr. Yablonicky says upper respiratory infections make up 25% of the patient visits, which are evenly divided between RSV, flu, and COVID having the least amount of patients. He says the differentiating symptom between all these three illnesses is that the flu causes a high fever.
Most people with influenza have a high fever. This is 102, 103. COVID and RSV typically have low-grade fevers. We're talking 99, 100.
To avoid urgent care, Dr. Yablonicky wants to remind everyone to take vitamin C, exercise regularly, and eat your fruits and veggies. But if you do end up in the emergency room, local hospitals are well prepared.
I think the hospitals in San Diego have learned a lot from COVID-19 and really developed different policies and are able to be flexible with these influx of illnesses. So I think we're probably better off handling influenza and RSV than we were several years ago. There are some silver linings to COVID-19 in that regard, in that we learned how to handle different patients.
Ariana Cohen, CBS 8.